Hello nursing students, welcome to the Chat Tech class of 2016 Simulation Orientation. Simulation is a great tool to put all the didactic theory from class into action. Some students enjoy the simulation experience, while others find it anxiety-producing. When asked what would make the experience better, students often express a desire to simply know what they're in for. Therefore, we have made this video as a sample simulation for you. Simulation begins with sign-ups for your date and time well in advance. As your simulation date draws near, you will also receive reading assignments and a DocuCare chart to review as directed. Be sure to prepare for your simulation beforehand. When your simulation begins, you will receive a report from the charge nurse as portrayed by one of the nursing instructors.
All right, Miss Baxter, she's a 63-year-old female. She was seen by her family physician for stomach pain and fatigue. So she's just admitted to the hospital for further workup of peptic ulcer disease. She has been diagnosed with like a gastric ulcer in the past. Upon admission yesterday, she was telling us that her stomach hurts. She's been real tired and feeling dizzy. Her last vital signs were blood pressure was 130 over 90. Her pulse was 97, respirations 24, and pulse ox was 94. She has no known drug allergies. She's doing vital signs about every 4 hours. She's on a clear liquid diet, bed rest. She has orders for Dilaudid and Pepcid. Dilaudid 1 milligram every 4 hours PRN, and then Pepcid 20 milligrams IV every 12 hours. She has a 20 to the right AC, and she has an order for 2 liters of oxygen nasal cannula.
Okay. All right. Is that starting at 94 or?
Yeah.
Okay. All right. Well, I appreciate it. You have a good night.
All right.
Bye. Simulations may be assigned as solo experiences or for 2 nursing students to work cooperatively. However, each student will be graded independently. If working with another student, be sure to spend some time reviewing the preparatory information together. As you will see, both student nurses coordinate actions to meet the needs of the patient. When you enter the room, remember hand hygiene, introduce yourself, and perform a head-to-toe assessment. Hi, Miss Baxter. I'm going to be your nurse today. I'm Patricia.
And I am Ashley. We're going to be taking care of you.
Okay. And how are you feeling this morning?
Oh, I'm in a lot of pain.
Okay. What we're going to do is we're going to check you out. What's your pain at right now if you were going to give me a number between 1 and 10?
It's about an 8, but I'm sorry, who are you guys again?
We're the nurses for you today. We're going to be taking care of you.
My name is Ashley, and this is Patricia.
Okay, well, my name is Eleanor Baxter, and my date of birth is 2/15/1943.
Thank you, Miss Baxter.
Okay, I'm just going to listen to you, and then as soon as possible we'll go outside and see if we can get you something for your pain, okay? Would that be all right?
That's fine.
Okay.
And she's
Can you
supposed
take
to
a
be
couple of
on.
deep breaths for me?
Okay, so when you come in, this is the screen where you're going to be reading your patient's vitals. And you can see you have the O2 here. This is the last time that the BP was run. It's going to say the time, the map. And so when you come in, sometimes your patient might need to have their vitals done every 5 minutes. So you're going to tap on that. This is going to come up. You're going to scroll down until you hit repetition time. Click on repetition time and you have several options. So for my patient, I want it to go every 5 minutes. And go to auto, and we are good to go. Start. supposed to be on 2 liters of nasal cannula. Let me go and ask the charge nurse if she can get us a nasal cannula. Hi. Charge nurse, can you get us a nasal cannula? Our patient's supposed to be on 2 liters of oxygen. Oh,
All right,
thank
I'm going to check your
you.
belly. Is that okay if I lift up your gown?
Fine.
Okay.
Okay, Miss Baxter, I have your oxygen here. I'm gonna put it on you, all right?
Okay.
All right, can you tell me where it, if you have any pain? Right there?
No, when you're on the left.
When I was on the left?
Oh,
Okay. All right, does the pain radiate anywhere else?
no.
Okay, when did that pain start?
It started about yesterday or so.
Okay, and is there anything that makes it better?
It starts when I eat.
When
And
you
then
eat?
when I just rest, it makes it better.
Okay, all right. I'm gonna check your pulse reflex.
Right now, her BP is at 136/92, pulse 78, SpO2 is at 92.
Okay, I'm gonna go get her Dilaudid. You have some Dilaudid. I'm gonna bring back some pain medicine for you. Okay, Miss Baxter?
Thank you.
All right, I'll be right back. Okay, so when you get medicines, you need to first pull up your order in DocuCare. And you're going to check your patient and the date of birth and make sure you're at the right patient. First thing we're going to do is we're going to take out the hydromorphine. It is 2 milligrams intravenous. Okay? So we'll come over here to the Pyxis system. In order to sign in, we're going to use the login and password that is right here. Okay. We're going to find our patient's name. Here's Eleanor Baxter. We have to okay the allergy information. She has no known allergies. And we're going to look at the medicine she has. Remember, we're looking for hydromorphone. It's a 1 milligram. We're going to select how many we want. Enter. This button down there pops the drawer open. We'll find the hydromorphone, which is what we're looking for. So 1 milligram or milliliter would be what we had. We want to make sure that we have the correct amount. Shut the door. There's 0 in the drawer now. When you're finished, you want to log off. Press done and log off. Okay, so from this screen in orders, we need to make sure we acknowledge all of our orders. I'm going to put in the date. Okay. Now in the MAR, you're going to check again that your medicine is what you have. And when we're ready to administer, we're going to go into the patient's room. This was our second check.
Be back.
Right.
Hand hygiene.
Okay, 1 milligram is what your doctor ordered. And can you just go ahead and tell me your name and date of birth one more time?
Eleanor Baxter, 2/15/1943.
Thank you. I'm just going to scan your arm bracelet. I'm just checking one last time that this is correct.
She's going to flush first. Make sure the IV is patent.
Make sure you pinch behind so it's not flowing back up. Since we don't have a clamp.
Just going to go ahead and push that slowly over about 1 minute. I'm gonna flush again.
In simulation, just like in the real world, things don't always go as planned. Be prepared to think on your feet. Patient safety is priority. This means you may have to administer emergency medication or oxygen before you do anything else. Reassess your patient. If you still need help, call your charge nurse.
Just gonna go ahead and flush again.
Oh, let me get the emesis basin for you, Miss Baxter. There we go. And I've got a towel over here. Oh, I am so sorry, Miss Bax. Oh. And that looks like cough ground emesis.
I think we need to call the doctor.
Yeah, let him know that looks like she's got her blood.
Is her blood pressure? How's her blood pressure?
Yeah, let me run it. Okay. Yeah, her blood pressure's dropping. It's 82/73.
All right, we'll go
wanna
ahead and call the
Call the doctor. Patient details. I've got the chart next to you.
Hello, Dr. Smith. This is Nurse Patricia. I'm with your patient, Eleanor Baxter. She had come in because of pain in her stomach, and right now she's just vomited coffee ground emesis, and her blood pressure is 82/73. About 5 minutes ago, we gave her an order of Dilaudid for her pain. Yes. Her initial pressure was 130/90. Yes. An IV bolus of 500 milliliters. Pepsid 20 milligrams IV piggyback. And inserted low intermittent suction. Okay, thank you. All right. Okay. So.
Miss Baxter, we are back with your medicine.
I've got some Pepcid for you, and the Pepcid is going to help you feel better. It's going to help your stomach feel better. But the first thing we're going to do is increase the amount of IV fluid that you're going to get because you got sick. We're also going to give you an NG tube. And the NG tube's going to take care of all that extra fluid in your stomach so you won't actually be getting sick anymore. Is that okay?
Okay.
So it's 999 over 100, right?
Yes.
Awesome. And you can see that it's changed from watching the drops that are coming through. Also how you can know if it's hooked up properly. And, oh, here's your towel.
Alright, and Miss Baxter, we're just going to sit you up.
Was I getting a 500 milliliter?
Yeah.
Okay, Miss Baxter. Just going to look in your nose. Have you ever had any nose surgery or unexplained nosebleeds?
No.
And can you, I'm going to shut this side. Can you breathe through this side, this nostril?
Yes.
And what about this nostril?
Yes.
Okay, good.
When you're missing something or need extra assistance, you can always call for the charge nurse, which is usually one of the instructors.
For Miss Baxter, because I'm going to put a nasal, an NG tube in her. Can you bring me a cup of water? Something that doesn't matter. Something that looks like a cup of water. Stand for cup. Thank you so much.
Yeah.
Similar straw.
We're just going to simulate that there's a straw with that.
Do we need to?
All right, Miss Baxter, I'm going to give you this cup with a straw in it. What I'm going to do is I'm going to put the NG tube up your nose, and as soon as I tell you to bring your head forward, tuck your chin, you're going to start swallowing. You're going to swallow the water. And that's going to help us put the NG tube all the way down into your stomach, okay?
She's lubricating the end of the nasal, the NG tube.
Okay. Lift your head up. All right, go ahead and tuck your head, chin. Swallow, swallow, swallow. Use the straw. Good. I know it's not very comfortable.
job. We're going to set this on intermittent suction.
She hooked up the famotidine to go into her IV.
And let's make sure that we're switching into a mask.
I'm just going to make sure that the bag inflates. Reassessing her abdominal sounds. Now she's going to check the stomach aspirate. She's going to check the pH.
There is no. Okay. And stick a strip in. Okay. We're in the right place. I'll get the phone. This is Nurse Ashley. How can I help you? Awesome. Radiology is on its way up for placement check. Great. We will see you shortly. Thank you. All right, Miss Baxter. Can you give me a thumbs up? Are you doing okay? Okay. Didn't quite get that. I think we're going to get clarification on that.
I believe she said she's doing better with the fluids.
Awesome. Well, I'm glad to hear that you're doing better, Miss Baxter.
How is your pain right now?
Okay. Will you check that bag, see if it'll inflate?